161. Acute lymphoblastic leukemia is the most common cancer in adults. True or false? Answer: false. Rationale: acute lymphoblastic leukemia, ALL, is the most common cancer in children, while cancers like breast, lung, and prostate are more prevalent in adults. 162. HPV infection is a risk factor for anal cancer. True or false? Answer: true. Rationale: high-risk HPV strains, e.g., HPV-16, are strongly linked to anal cancer, similar to cervical cancer, increasing risk particularly in immunocompromised individuals. 163. PSA testing is used to screen for bladder cancer. True or false? Answer: false. Rationale: PSA testing screens for prostate cancer, not bladder cancer, which is diagnosed with urinalysis, cystoscopy, or imaging to detect hematuria or tumors. 164. A core needle biopsy can diagnose breast cancer. True or false? Answer: true. Rationale: a core needle biopsy removes tissue samples from a breast lesion, allowing histopathological analysis to confirm breast cancer diagnosis with high accuracy. 165. Immunotherapy can cure all patients with metastatic melanoma. True or false? Answer: false. Rationale: while immunotherapy, e.g., pembrolizumab, has improved outcomes in metastatic melanoma, it does not cure all patients, as response rates vary due to tumor heterogeneity and resistance. 166. Spinal cord compression is a complication of multiple myeloma. True or false? Answer: true. Rationale: multiple myeloma causes bone lesions and vertebral collapse, which can compress the spinal cord, leading to pain, weakness, or paralysis, requiring urgent intervention. 167. Chemotherapy can cause diarrhea as a side effect. True or false? Answer: true. Rationale: chemotherapy damages rapidly dividing intestinal mucosal cells, causing diarrhea, which requires hydration, antidiarrheal medications, and monitoring for dehydration. 168. All cancers are hereditary. True or false? Answer: false. Rationale: only 5 to 10% of cancers are hereditary, e.g., BRCA-related breast cancer, while most are caused by acquired mutations from environmental, lifestyle, or idiopathic factors. 169. A high-fiber diet can reduce the risk of breast cancer. True or false? Answer: false. Rationale: while a high-fiber diet reduces colorectal cancer risk, evidence linking it to breast cancer risk reduction is inconclusive, though it supports overall health. 170. Low-dose CT screening is recommended for high-risk lung cancer patients. True or false? Answer: true. Rationale: low-dose CT screening is recommended annually for high-risk individuals, e.g., heavy smokers aged 50 to 80, to detect lung cancer early, improving survival rates. 171. Hypercalcemia is always symptomatic in cancer patients. True or false? Answer: false. Rationale: hypercalcemia in cancer patients may be asymptomatic in early stages, detected only through lab tests, but can cause symptoms like confusion or fatigue as levels rise. 172. Chemotherapy can be administered safely during the 3rd trimester of pregnancy. True or false? Answer: true. Rationale: certain chemotherapy drugs can be safely administered in the 3rd trimester with careful monitoring, as organogenesis is complete, posing lower fetal risk than in the 1st trimester. 173. Lymphedema is a common side effect of chemotherapy. True or false? Answer: false. Rationale: lymphedema is typically caused by lymph node dissection or radiation, not chemotherapy, which more commonly causes side effects like nausea or neutropenia. 174. Tumor markers are used to confirm cancer diagnosis. True or false? Answer: false. Rationale: tumor markers, e.g., PSA, CA-125, support monitoring or screening but are not confirmatory for diagnosis, which requires biopsy and histopathological examination. 175. Hospice care can be provided in a patient's home. True or false? Answer: true. Rationale: Hospice care is often provided in the patient's home, as well as in facilities, focusing on comfort and quality of life for patients with a prognosis of 6 months or less. 176. Testicular cancer is the most common cancer in men over 50. True or false? Answer: false. Rationale: testicular cancer is most common in younger men, ages 15 to 35, while prostate cancer is the most common in men over 50. 177. Chemotherapy can cause ototoxicity as a side effect. True or false? Answer: true. Rationale: certain chemotherapy drugs, e.g. cisplatin, can damage inner ear structures, causing ototoxicity, manifesting as hearing loss or tinnitus, requiring baseline audiology testing. 178. A low-fat diet is recommended for all pancreatic cancer patients. True or false? Answer: false. Rationale: pancreatic cancer patients often require a high-calorie, high-protein diet to combat weight loss and cachexia, with fat intake tailored to digestive capacity and symptoms. 179. Li-Fraumeni syndrome increases the risk of multiple cancers. True or false? Answer: true. Rationale: Li-Fraumeni syndrome, caused by TP53 gene mutations, increases the risk of multiple cancers, including breast, sarcoma, and brain tumors, often at a young age. 180. Pain management in palliative care is only pharmacological. True or false? Answer: false. Rationale: pain management in palliative care includes pharmacological, e.g., opioids, and non-pharmacological approaches, e.g., massage, acupuncture, to address pain holistically. 181. Colorectal cancer screening is recommended starting at age 60. True or false? Answer: false. Rationale: colorectal cancer screening is recommended starting at age 45 for average-risk individuals per American Cancer Society guidelines, with earlier screening for high-risk groups. 182. Radiation therapy can be used to treat brain metastases. True or false? Answer: true. Rationale: radiation therapy, including whole brain radiation or stereotactic radiosurgery, is used to treat brain metastases, reducing tumor size and alleviating neurological symptoms. 183. Thrombocytopenia is a side effect of radiation therapy. True or false? Answer: false. Rationale: thrombocytopenia is primarily a chemotherapy side effect due to bone marrow suppression, while radiation typically causes localized effects like fatigue or skin changes. 184. Non-Hodgkin lymphoma is always aggressive. True or false? Answer: false. Rationale: non-Hodgkin lymphoma includes both aggressive, e.g., diffuse large B-cell lymphoma, and indolent, e.g., follicular lymphoma, subtypes, with varying treatment and prognosis. 185. Therapeutic communication avoids discussing cancer recurrence fears. True or false? Answer: false. Rationale: therapeutic communication encourages open discussion of recurrence fears, validating emotions, and providing support to help patients cope with anxiety. 186. Osteosarcoma is a common bone cancer in adults. True or false? Answer: false. Rationale: osteosarcoma is a primary bone cancer primarily affecting adolescents and young adults, while metastatic bone cancers, or myeloma, are more common in adults. 187. Chemotherapy can cause pulmonary toxicity as a side effect. True or false? Answer: true. Rationale: certain chemotherapy drugs, e.g., bleomycin, can cause pulmonary toxicity, leading to fibrosis or pneumonitis, requiring monitoring of respiratory symptoms and lung function. 188. A sentinel lymph node biopsy is used to diagnose lymphoma. True or false? Answer: false. Rationale: sentinel lymph node biopsy is used for staging solid tumors like breast cancer, not lymphoma, which is diagnosed via lymph node biopsy or bone marrow analysis. 189. Targeted therapies can cause hypertension as a side effect. True or false? Answer: true. Rationale: targeted therapies like VEGF inhibitors, e.g., bevacizumab, can cause hypertension by affecting blood vessel function, requiring blood pressure monitoring and management. 190. superior vena cava syndrome is always symptomatic. True or false? Answer: false. Rationale: superior vena cava syndrome may be asymptomatic in early stages, detected incidentally on imaging, but often progresses to symptoms like facial swelling or dyspnea. 191. Surgery is the only treatment for early-stage prostate cancer. True or false? Answer: false. Rationale: early-stage prostate cancer can be treated with surgery, radiation, or active surveillance, depending on the patient's risk profile and preferences. 192. Patient education includes teaching cancer patients to avoid live vaccines. True or false? Answer: true. Rationale: cancer patients, especially those on immunosuppressive treatments, should avoid live vaccines, e.g. MMR, due to infection risk, requiring inactivated vaccines instead. 193. Cervical cancer is primarily caused by smoking. True or false? Answer: false. Rationale: cervical cancer is primarily caused by high-risk HPV infection, though smoking is a risk factor that can exacerbate HPV-related cellular changes. 194. Fatigue in cancer patients can be managed with nutritional support. True or false? Answer: true. Rationale: nutritional support, including adequate protein and calorie intake, can help manage cancer-related fatigue by addressing malnutrition and supporting energy needs. 195. Hormonal therapy is used to treat all types of ovarian cancer. True or false? Answer: false. Rationale: hormonal therapy is used for certain ovarian cancers, e.g., low-grade serous carcinoma, but not all types, which may require surgery, chemotherapy, or targeted therapies. 196. Oncologic emergencies can be managed in outpatient settings. True or false? Answer: false. Rationale: oncologic emergencies like tumor lysis syndrome or spinal cord compression require inpatient management due to their life-threatening nature and need for rapid intervention. 197. Testicular cancer screening includes routine ultrasound for all men. True or false? Answer: false. Rationale: routine ultrasound is not recommended for testicular cancer screening in asymptomatic men. Self-exams and clinical evaluation are advised, with ultrasound for suspected cases. 198. Cachexia in cancer patients is solely due to tumor size. True or false? Answer: false. Rationale: cachexia results from tumor-induced metabolic changes, inflammation, and cytokine release, not just tumor size, leading to muscle wasting and weight loss. 199. Antiemetics are used only for chemotherapy-induced vomiting. True or false? Answer: false. Rationale: antiemetics are used for chemotherapy-induced nausea and vomiting, as well as nausea from radiation, surgery, or other cancer-related causes, to improve patient comfort. 200. End-of-life care in oncology includes advanced care planning. True or false? Answer: true. Rationale: end-of-life care in oncology involves advanced care planning, discussing patient preferences for treatment, resuscitation, and goals to ensure care aligns with their values.